Heart attack. The symptoms of heart attack include persistent pain in the centre of the chest, discomfort to unbearable pain, pain in the shoulders, arm, neck or jaw, constant pain, shallow breathing, sweating, pressure, squeezing, tightness, aching or heavy sensation in the chest, pale skin. To treat a heart attack, you must act with speed. Call for medical assistance immediately.
Start rescue breathing and CPR if necessary.
And make the person comfortable. Stroke.
FAST is a simple way of remembering the signs of stroke. F. Facial weakness. Can the person smile? Has their mouth drooped? A. Arm weakness. Can the person raise both arms? S. Speech difficulty. Can the person speak clearly and understand what you say? T. Time to act fast. Seek medical attention immediately. Dial 000 and ask for ambulance.
Symptoms of stroke include looking or feeling ill, behaving abnormally, sudden weakness or numbness in one side of the body, difficulty in speaking, blurred or dim vision, unequal pupils, and severe sudden headache. Treatment. If a victim is unconscious, follow the ABCs method. Call for medical assistance immediately. Put the victim in the recovery position. This will help to drain any fluid or vomit that may occur. Do not give them any food or liquid. Comfort them, as victims of stroke are often distressed and confused. Choking.
The simplest way to assess severity of foreign body airway obstruction, or FBAO, is to assess for effective or ineffective cough. Signs of partial obstruction. Breathing is laboured, breathing may be noisy, some escape of air can be felt from the mouth, effective cough. Signs of complete obstruction. There may be efforts at breathing, there is no sound escaping, there is no escape of air from the nose or mouth, ineffective cough. The victim with an effective cough should be given reassurance and encouragement to keep coughing to expel the foreign material. If the obstruction is not relieved, the rescuer should call an ambulance on 000. If the person with a severe airway obstruction is conscious, call an ambulance on 000 and perform up to 5 sharp back blows with the heel of one hand in the middle of the back between the shoulder blades. Check to see if each back blow has relieved the airway obstruction. The aim is to relieve the obstruction with each blow rather than give all 5 blows. An infant may be placed in a head downwards position prior to delivering back blows, that is, across your lap. If back blows are unsuccessful, you should perform 5 chest thrusts. Check to see if each thrust has relieved the airway obstruction. The aim is to relieve the obstruction with each chest thrust rather than give all 5 chest thrusts. To perform chest thrusts, identify the same compression point as for CPR and give 5 chest thrusts. These are similar to chest compressions but sharper and delivered at a slower rate. The infant should be placed in a head downward supine position across your thigh. Children and adults may be treated in the sitting or standing position. If the obstruction is still not relieved, continue alternating 5 back blows with 5 chest thrusts. An unconscious victim should be placed in the recovery position and a finger sweep can be used to help clear the airway. The rescuer should call an ambulance on 000 and commence CPR.
Fainting.
Fainting is a lay term used to describe a condition of sudden, brief loss of consciousness with the potential for full recovery. Fainting should not be confused with loss of consciousness from shock or any other cause. Frequently, there are associated warning signs preceding loss of consciousness, namely lightheadedness, nausea, sweating, feeling of anxiety. Loss of consciousness is usually brief, from seconds to 1 or 2 minutes. providing the victim lies down. Some conditions which may cause fainting include standing for prolonged periods in hot weather or in a hot shower, the sight of needles, particularly prior to or after an injection, the sight of blood, or pain. Brain damage or death may occur if the victim is left supported in an upright position, such as a chair or jammed upright in a crowd. Be aware of situations which may lead to fainting. Consider lying the person down when taking blood or giving an injection. If the person is in a chair, remove the victim from the chair and assist into a horizontal position. Lie the victim flat, raise the legs if feasible, place all unconscious victims on the side. A pregnant woman should be turned onto the left side. Assess the victim for any injuries resulting from a fall. Never sit the victim on a chair with the head placed between the knees.
Crush wounds. Crush wounds can happen in a number of different ways. One situation in which they commonly occur is at rock concerts where crowds surge forward. The symptoms of crush wounds include numbness, tingling, swelling, rigidity, bruising, and signs of both shock and fractures. Be aware that the signs and symptoms may not immediately be obvious. To care for crush injuries, remove the crushing force immediately unless the victim has been trapped for more than 60 minutes. After 60 minutes, releasing from the crush will cause the tetanus toxin to be released into the bloodstream, possibly causing death.
Crush wounds. Call an ambulance, dial 000, keep the victim comfortable. Do not use a tourniquet for the first aid management of a crush injury. Continue to monitor the victim's condition and vital signs.
Heat exhaustion. Heat exhaustion is a common condition that especially affects people who spend long periods in strong sunlight at work or at play.
Heat first aid. Heat exhaustion, signs and symptoms. Fatigue with headache, nausea, vomiting, malaise and dizziness which may be accompanied by collapse. Body temperature will be less than 40 degrees Celsius. Conscious state will become normal once the victim is lying down. Treatment. Lie the victim down. Loosen and remove excess clothing. Moisten the skin with a moist cloth or atomizer spray. Cool by fanning. Give water to drink if fully conscious. Call for an ambulance, dial 000. Keep in the shade. Heat stroke, signs and symptoms. Temperature above 40 degrees Celsius. Central nervous system, CNS involvement. A hot, dry skin. However, in some victims, profuse sweating is common. Treatment. Call for an ambulance, dial 000. Place the victim in a cool environment. Moisten the skin with a moist cloth or atomizer spray and fan repeatedly. Apply wrapped ice packs to neck, groin and armpits.
Muscular cramps occur due to a salt imbalance in the body. To assist muscle cramps, firstly, rest the victim in a cool place, give the victim cool water, loosen tight clothing and cool the body with wet cloths to the skin and fan the victim. Start rescue breathing and CPR if necessary. Cold emergencies. Frostbite and hypothermia. Frostbite is the freezing of body tissue. It usually occurs in exposed areas of the body, depending on the air temperature, length of exposure and the wind. In superficial frostbite, the skin is frozen, but the tissue below are not. In deep frostbite, also called freezing, both the skin and underlying tissue are frozen. The ice crystals and swelling may damage or destroy the cells. Frostbite can cause the loss of fingers, hands, arms, toes, feet and legs. The symptoms and signs of frostbite include lack of feeling in the affected area, skin that appears waxy, skin that is cold to touch, skin that is discoloured, either flush, yellow, white or blue. When caring for frostbite, handle the area gently. Never rub an affected area, as this will cause further damage because of the sharp ice crystals in the skin. Follow these steps. 1. Take the victim to shelter before gently removing any clothing or covering from the affected area. 2. Immediately re-warm the affected parts by skin-to-skin heat transfer from a warm part of yourself or the person. For example, place frostbitten hands in the victim's own armpits or frostbitten feet into your armpits. Cover frostbitten ears, nose or face with warm hands until colour and sensation return. 3. As an alternative, re-warm the area by gently soaking the affected part in warm water. Test the water temperature first because hot water can cause further damage. 4. Lightly cover the area with soft dressings. If fingers or toes are frostbitten, place soft material such as cotton or tissue between them. Avoid breaking blisters. 5. Raise the affected parts to help reduce pain and swelling and immediately seek medical attention. Hypothermia. In hypothermia, the entire body's warming mechanisms fail, causing the body temperature to drop below 35 degrees Celsius. This will not register on a normal thermometer. As the body temperature cools below 28 degrees Celsius, the heart begins to beat erratically and will eventually stop, resulting in death. Signs of hypothermia include shivering, which may be absent in later stages, slow, irregular pulse, numbness, glassy stare, decreasing levels of consciousness and apathy, abnormal coordination and trouble walking. The air temperature does not have to be below freezing for people to develop hypothermia. Elderly people in poorly heated homes or homeless people with poor nutrition who get little exercise can develop hypothermia at higher temperatures. People on drugs or who are sick are also at risk. Anyone remaining in cold water or wet clothing for a prolonged period of time may also easily develop hypothermia. Hypothermia is a medical emergency, so immediately call for an ambulance. Carry out a primary survey and take the following steps. 1. If insulation or shelter is available, remove wet clothing and dry the victim. If shelter is not available, wrap something dry over the victim's wet clothing to prevent exposure to cold wind that would rapidly chill the body. Be extremely gentle in handling the person. 2. If available, apply hot water bottles, heating pads or other heat sources to the armpits and groin. Keep a blanket, towel or clothing between the heat source and the victim to avoid burning the skin. The rescuer's own body heat may also be used. 3. If available, give the victim warm liquids to drink. 4. Do not immerse the victim in warm water. Rapid re-warming of the whole body can cause the onset of dangerous heart rhythms.